and then going to introduce our next speaker, who's Julia Bradford, who's one of our patient partners, who's going to be speaking about her lived experience of lymphedema. So over to you, Julia.
Yeah, hi everyone. I'm going to talk a bit about how and when I was diagnosed with lymphedema, what it was like both as a hospital patient and a patient as a primary care patient, and a little bit of what it's actually like to live with that. I'd like to start off though by saying three things. Just to be clear, my secondary lymphedema was caused by breast cancer treatment. For the most part, I'm referring to the lymphedema affecting my arm. And this last bit, I think, always needs to be emphasised. When you're diagnosed with cancer, you don't want to die of it, but your quality of life really matters. And I think Faye brought that out in her presentation. I was diagnosed at a relatively young age. I was diagnosed in my 40s. So not only does your quality of life matter, but it matters about aging well when you're living with the consequences of your treatment. So my early stage breast cancer was diagnosed 10.5 years ago. My secondary lymphedema was diagnosed 10 years ago. So there's many people like me for whom lymphedema starts more or less straight away during treatment. And I actually happened to be diagnosed within 6 weeks of my radiotherapy finishing. The hindsight's quite a good thing. It could well have been my left arm, my surgery side, was swelling after surgery or during chemo or both. But I wasn't really aware of it until after I had whole breast radiation, which caused me some quite awful problems and actually made me very hyper aware of the symptoms of lymphedema. At that point, I'd moved back to my general hospital, Croydon University Hospital. So I was being looked after by my breast care nurses. So I went to see them and said that I think this is what's happening. And they were quite good. They said, yes, if it looks like a duck, walks like a duck and quacks like a duck, it probably is lymphedema. But they weren't able to give me a formal diagnosis. They couldn't refer me into the breast clinic to get a diagnosis. I had to go back to the Royal Marsden where I'd had my cancer treatment. So that's one obstacle really initially I found, was trying to get a formal diagnosis so I could start treatment, start to manage the secondary lymphedema. Once I finally managed to see my oncologist and he confirmed that it was in fact what I had, the breast care nurses could take over. So initially that meant going to see them every 6 months. They were monitoring my arm, they were taking measurements, and they were giving me the compression garments. So the aim is to stabilise your swelling. Because lymphedema is not a static condition. The swelling in your arm can go up, it can go down. If you lose weight, you gain weight and things happen, or you develop infections like cellulitis. It can all affect the size of your arm. Once I managed to get some stability, or my nurses helped me to get some stability in the swelling, they started writing prescriptions for me to take to my GP. And this is where it started to go quite hideously wrong. In theory, if you get a lymphedema prescription and it specifies your garment, it puts down the product reference number, ID codes, PIN codes, your GP should be able to look at the database available to them of compression garments, just simply transfer that to prescription, you get it from a community pharmacist. In reality, that's not what happened. My GP had considerable difficulty with the database. It wasn't my GP's fault. The database is awful and deserved deleting and something new being built. So first of all, your GP has problems trying to find the right garments and matching it up with your lymphedema, your compression garment prescription. When you take it to the community pharmacist, I found I often got the wrong garments. So not only is it a huge waste of money for the NHS, it was a huge waste of money for me, of time for me. I couldn't manage my condition properly. Caused me an awful lot of stress and anxiety, and I caused my GP an awful lot of stress and anxiety by going backwards and forwards trying to get something done about it. This was eventually solved by my breast care, my practice nurse actually handwriting a prescription and getting the doctor to sign it. The Royal Marsden lymphedema team helped me find a specialist pharmacy. So now what happens is I send them the prescription, the specialist pharmacy make sure it's all correct according to my lymphedema script, and then they get the GP to dispense it for me. So they dispense it for me and they get a prescription from the GP. It shouldn't really be that hard as a community patient to get the right garments prescribed for you. And it's really important, because if you're not able to get the right things to manage your condition, then it causes all kinds of problems, including leaving you open to cellulitis and all kinds of things. So that was one problem, trying to solve getting the right garments. The second problem, as a community patient, is actually getting access to lymphedema therapists when something changes clinically. So one of the major problems I've had in recent years is that I kept getting bouts of recurrent cellulitis. So that makes your lymphedema worse, it causes more damage to your arm. I'm extraordinarily lucky because I was a Royal Marsden patient. It shouldn't really be down to luck, but because I was treated there initially and was seen by the lymphedema team there in the early stages, my GP is able to refer me back to be seen if things change clinically. So they were able to see me when I was suffering with the problems with cellulitis, and now I'm on daily antibiotics, which I will be taking for at least another year, and then have a review to see if things have calmed down, and I can move forward from that. You should be able to access some help in the community to manage lymphedema. It's a manageable condition, but as I said, things can affect your prescription. There is no one I can really go to have my arm measured. I have to ask for help or to be referred back to the Royal Marsden if I think things have changed really drastically, and it makes it really a bit more stressful to manage as a long-term condition. So that's on top of, I mean, I've been living with it for 10 years, so I've managed to make that adjustment. But I think with people being diagnosed, it's really helpful that they have some support that they can rely on, that they can go to someone and say, I think my arm is getting worse, I think my prescription has changed, I just need someone who's actually qualified to check this. So that is one aspect of trying to live well with a condition like lymphedema. And I think as well, sometimes the chronic long-term living with a chronic condition, the emotional and mental impact is often overlooked. I used to have an office job, so I had to go through an occupational health process to get an adaptable keyboard and mouse to reduce the strain on my arm. Things like buying clothes become a bit of a pain, because you have to fit your clothes to your arm. You have to change even your underwear. You have to change. You have to stop wearing underwire bras. You have to try and find different kinds of underwear, because I have breast lymphedema, but it also, anything too tight around you can affect the swelling in your arm. So there's all kinds of aspects to living with these long-term conditions. But one of the reasons I wanted to do this, although I was diagnosed with it a long time ago, is just to emphasise really that late effects don't stop at 5 years when you're discharged as an early stage patient. We're always at risk of developing these long-term problems, and if we've already been diagnosed with something, we need to have that or that ability to access medical support when we need it. And it's not that we need hospital care or primary care all of the time. It's just that sometimes things will change and we need to be able to go and see someone and say, you know, I think I need a checkup. So that is really that, really. So I'm in a much better position than I was 10 years ago. I can get my, I've got a great compression pharmacy. I know I will get the garments that my therapist has prescribed for me, which is a relief, relieves a huge source of stress. And I do much better at looking after myself. But it is quite a burdensome condition because you have to, your compression garments, you have to do your exercises to manage the swelling, and you have to keep on top of what is going on. So I'm very grateful to Faye as well for pointing out some of the quality of life issues in her presentation, because yes, as you know, to say as a final point, we're very grateful to be living after early breast cancer, but I'm not too grateful for the long-term consequences I have to manage. So sometimes you need some help to get through that.